everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're doing another care plan. So let's get into it. Our patient is a 48-year-old man presenting with severe abdominal pain. He's giving it a 10 out of 10. He reports nausea and vomiting and states he just can't keep anything down. His temperature is 101.2 degrees Fahrenheit. The doctor gives him a medical diagnosis of acute cholecystitis, so gallbladder. The patient begs the nurse, "You have to help me." So he's in so much pain and he's saying, "Please, you have to help me. You have to believe my pain." So, of course, we can't just ignore this 10 out of 10 pain. So our first diagnosis and our priority is going to be acute pain. So it's acute pain related to that gallbladder inflammation, because that's what's causing the pain. And as evidenced by our proof, is he's saying he has 10 out of 10 pain. Our goal will have the patient state a decrease in pain on the 0 to 10 scale by the end of the shift, because that's a pretty reasonable amount of time. And now our intervention is going to be a little bit special. I didn't want to do like the basic, like we're going to give him a pain med, right? Because of course definitely we're going to do that. But I wanted to address something else. The fact that he says, "You have to help me." So most people do not experience 10 out of 10 pain very often. And so when they do and they present to like the emergency room, there is this fear and anxiety that they're not going to believe me that it hurts this bad. So for our intervention, I picked something a little special. So our intervention, assure the patient that you know the pain is real and you will assist with reducing it. So letting them know that, yes, I trust you, I believe you. And how is this going to help? Fear that the pain will not be considered real increases anxiety and reduces a patient's pain tolerance. So that's why this is important too. And our evaluation, we can say our goal was met. The patient reported 8 out of 10 pain by the end of the shift. Now, something like this is not going to be as effective as giving like a narcotic or an opioid, right? That's not going to help the pain at that level, but it is going to help it a little bit. Hopefully it'll help it a little bit, reduce the anxiety and increase their pain tolerance. So they can say, okay, it's not a 10 out of 10, it's an 8 out of 10. So I wanted to do that one. It's a little bit special than our typical pain. The other thing we have to address here is this nausea, vomiting, and fever. So this patient has a risk diagnosis. They are at risk for electrolyte imbalance related to the nausea, vomiting, and the fever. So our goal would be the patient will have no signs of dehydration upon assessment and will have serum electrolytes within a normal range in 24 hours. So what are we going to do? We're going to monitor the hydration status by assessing their skin turgor and their temperature and monitoring those serum electrolytes. And then our rationale, things like dry skin can indicate fluid deficit, and monitoring serum electrolytes helps us to identify trends. So we'll get a baseline and then we'll do follow-up labs to make sure that they're staying the same and that they're not, dropping or raising, things like that. And then evaluation, once we've done all that, hopefully we'll say our goal was met. The patient was free from signs of dehydration, and the patient's temperature and serum electrolytes were in normal range within 24 hours. And that is a pretty realistic time, because this is an acute thing. This is something we're going to take care of right away. So that was my video. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.